Hello and welcome to Health Talk. I'm Dr. Manny. Nearly 44% of African American men and 48% of African American women have some form of cardiovascular disease. There are some things you can do to reverse those alarming numbers. Lamman Rucker is one of the stars of the hit series Greenleaf on the OWN network, and he's teaming up with the American Heart Association, the Association for Black Cardiologists, to raise awareness about heart health in the black community. Here to tell us more is Lamman himself. Welcome, sir. Great honor to see you. Important topic. 44% African American, even Latino population, the same thing. Cardiovascular disease, the number one problem that we have in this country. Why did you pick up this challenge?
Well, as you might expect, these issues have affected me personally, my family members as well, and just being a young man of color and being aware of these numbers and the health disparities that exist. It was just evident that something needed to be done, and there's never too many soldiers in the fight for positive change. So, I just decided that this was a very positive partnership and a healthy relationship, and if I can be part of the solution and not the problem, here I am.
Let me go back, because I have some theories myself, but tell me what have you learned about, why are these issues of cardiovascular disease so prevalent in the African American community? What have you learned statistically? Yeah,
well, I can definitely speak more socially and sociologically, if you will, as opposed to I'm not as a trained doctor as you are, but at the same time I have had the education of knowing about physiology and being aware of how my body works, how the body works at an optimal level, and what kind of things happen when the body is not functioning at an optimal level. So you learn what you can prevent, and you also learn sometimes what kind of things you inherit. And I think more of what you inherit, as opposed to just saying that, we're just genetically, have this disposition, that a lot of what can change and is changeable and is preventable is simply our habits. They're lifestyle things. They're things that are connected to even the lack of information that often exists. So if one person lacks the information and nobody else goes and gets the information, and then nobody else goes and gets the information, now you've got this generational apathy and this generational just ignorance and lack of information that exists. So when you talk about organizations like the Association of Black Cardiologists and all the very many other initiatives and movements, if you will, and organizations that are in this fight, a big part of it is educating people, giving them access to the right kind of information, getting them to understand what healthy alternatives are.
Let's talk about messages to our communities. What do you want to see? I mean, when we talk about culture, what are we saying to the African American communities about lifestyle, about eating, about going to see the doctor?
You have to make some difficult choices sometimes. You got to push back from the table. You might have to, lessen your portions. You watch what you eat, how late, and, what you're putting in your body, and it makes a huge difference. So.
You are the master of ceremonies for a very important event, the Spirit of the Heart Awards Gala. You're going to be there. What's going to happen?
Well, there's a number of things that are going to happen. You're going to meet some really wonderful people that are going to be acknowledged for their contributions and the kind of advocates that they've been throughout this fight and this work. They've had illustrious careers in the fields of cardiology. Even posthumously, you've got a couple people that are being acknowledged, as well. But just really learning about the history of ABC, Association of Black Cardiologists, and the number of the other people that have just really been doing some remarkable things, even when it comes to research, which is a big part as well. When we're talking about, like you're saying, all hands on deck, a big part of it is also representation. And if you don't have people who are from the community, who understand the community, understand the needs, if you will, the dialects, the tone and the sensitivity and the compassion of that community, you also, there's a certain level of comfort, that comes with that, a certain level of trust. and therefore also a certain level of, I think, progress that happens when people look like you, sound like you, understand you, and are talking sense.
Right.
People are more inclined to listen and follow their example.
And I hope, which is my prayer as a health educator in School of Medicine, that more kids, African American kids, Latino kids, choose the field of science. Become the doctors of tomorrow. We need more doctors that look like our patients.
That's right.
That's what we need, so that you understand. When you come from that world and you get your degree and you go into the science field, you're going to bring something different to the table.
Absolutely.
The science is always the same, you know?
Yeah.
Molecules are molecules.
That's right.
and all of that.
That's right.
But you're going to bring something different. And you're going to break through, because we're going to have the same segment 30 years from now. Right. I may not be around 30 years from now, but you certainly
Well, you will, and you'll be in great health, too. I trust that. Yes, you will.
But we're going to be talking about the same thing, and something has to give. So I thank you for what you do, man.
Human beings are human beings.
I think it's very important.
We love our pleasures. We want to do what we want to do, and we want to just enjoy life. But it's got to go hand in hand with some discipline, some value for your life. And aside from just yours, it's also about limiting, if not eliminating, the generational patterns of of this kind of
good stuff,
behavior.
Good stuff.
So
thank you
One
you
person
very
at
much.
a time.
Where can people get more information? We have a website or something?
abcardio.org.
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 All right. Well, thank you so much for joining us.
My pleasure.
And if you have any health questions, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.